KVUE's Molly Oak spoke with Dr. Mark McClellan, the director of the Duke-Margolis Center for Health Policy and a chief medical advisor on Governor Abbott's strike force. They talked about how Texas is preparing for the vaccines.
I think when people hear a vaccine is coming, like you mentioned, it's not going to go to everyone right away. It's going to go to those healthcare workers, the higher risk groups like elderly. What does the distribution look like for Texas, and what does that preparation look like?
Well, there's a lot of preparation going on right now. The first places to get the vaccines in Texas will be the healthcare organizations that have been really hard hit. And so those organizations like Dell Medical in Austin and Ascension Healthcare and others are preparing right now for informing their employees about the vaccines and starting to vaccinate them. It's probably going to take, because we've got 20 million plus healthcare workers, a couple of months at least before the vaccines are broadly available to all of them. And again, it's 2 doses, 21, 28 days apart, and a little bit of time after that for the immunity to kick in. The other places that will be getting early access in Texas include nursing homes, and the federal government has set up a special arrangement to bring in partners from the private sector like CVS or Walgreens to vaccinate as many people in a nursing home as want it. So those are going to be the earliest access, potentially in December.
How do you all decide what cities or what hospitals will receive those doses first?
The federal government's working very closely with state leaders, so the governor and his public health advisors, to take the amount of vaccine that's available, that's allocated to the different states, and work with them on getting to the places that are needed. So there's some national guidance on this available from the federal government. That's going to get refined as more vaccines become available, and we start thinking about vaccinations going beyond places like healthcare facilities and nursing homes and into other high-risk populations, including people who are over 65 or have chronic diseases, and communities that have been hard hit, including lower-income communities, communities of color, as well as efforts to reach other essential worker populations